Hello, this is Lawrence Holvey again. This is video number 4 in my series on the rotator cuff group of muscles and shoulder uh, injuries. And the fourth one is on whether treatment can help, and if so, what kind of treatment. So we talked about, what happens when it goes wrong: tears, complete tears, shoulder cuff arthropathy, when it glides up into the shoulder joint, big inflammation. Now, first of all, where I can help, start with that. If the tear isn't too big, then things like osteopathy and acupuncture can definitely help. In about 70% of patients I see, they all recover well. One note of caution, though, is that they don't repair overnight. So many people I see, and I might have treated their back or ankle or some other bodily part, and they improve quickly. In 1 or 2 sessions, the person's coming back, and that's really because it's mechanical problems, that the joints aren't moving properly, and just by getting them moving, they're restored back to normality fairly quickly. With the shoulder, because of the inherent injury, i.e. there is a tear with inflammation, as I've explained in previous videos, the shoulder is unstable, inherently unstable, so you're having to deal with that. And also the amount of inflammation that's often provoked with these types of injuries. They take time to recover. So patience is always needed. So if I get a person with a tear, you instead of 1 or 2 sessions, sometimes getting them back to normal, it can take a number, 5, 6 sessions. However, I would always argue this is better than surgery, because surgery, you're out for at least 6 weeks, with your shoulder in a sling, with its own inherent problems of things called frozen shoulder, which maybe I'll give a talk on that soon, because that's another very popular topic. So I would always argue it's probably worthwhile having conservative type treatment using osteopathy and acupuncture. And where that really helps is that things like osteopathy, where you're actually moving the shoulder about, the whole point is stimulation of blood flow, and because you're stretching tendons, you're stimulating the tenocytes, the small cells that produce tendon, to turn over more quickly, so that tendons become stronger, and if they can heal, they heal quickly. And also it prevents things like frozen shoulder developing, because one of the reasons a frozen shoulder, or the technical name adhesive capsulitis, forms is that if you keep your shoulder immobile, which often is the case after injury, it comes up, you stop using it, and again you lose it, so you lose that function. So any sort of physical treatment, manipulative treatment, helps improve movement. So osteopathy is very useful in helping any sort of rotator cuff problems. It also helps, and also a group of exercise once it's settled down, to help strengthen up the whole cuff, give that added stability. I also very often use acupuncture, because acupuncture is, there's a lot of studies have been done, which you can look up, in scientific journals. We're not talking about, just things on the internet that are said. I mean, they've been validated in double-blind trials, etc., and in different university departments. It shows that acupuncture is very useful to help shoulder problems, both in restriction and helping get rid of pain that's the result of inflammatory conditions as a result of tendon problems. So acupuncture, I very often use acupuncture in conjunction with osteopathy as being the ideal couple to help reduce a person back to normal. For normal, again, if you've watched, I think it was video 3, on anything up to grade 2, grade 3 tears, success rate 60-70%. So it's quite good. Obviously you don't get nobody ever gets 100% success rate. So, but it's, as I've said before, it's certainly worth pursuing, and you've got a good chance of being helped and got back to normal relatively easily, relatively quickly, and dare I say, relatively pain-free. So the next thing, of course, is that what happens when conservative treatment fails, i.e. the person doesn't get better, which does happen. And it again depends on what the problem is. If it's just a case of too much inflammation, which I talked about in my last video, um, then steroidal injections are worth considering because it helps dampen down the inflammation. And if the inflammation dampens down, the patient is out of pain, which is very useful and helpful. If they're out of pain, maybe I can work on them and they can recover satisfactorily. As it's not curative, and long-term studies do show that steroidal injections have no long-term benefit over anything else. So if you can avoid it, probably better, but certainly as a short-term measure can be useful to help shoulders dampen down the inflammation and the pain in there. So very often, for example, with impingement, which I've mentioned, when there's actually swelling of the tendon, and it doesn't, when I treat somebody after 3 sessions, it's not getting that much better, I sometimes advise to get a steroidal injection just to get them past that, somebody past that impasse of not recovering quickly enough. But I'm always, I like to work fairly quickly. So many people I see, I've treated them 3 times, and on the 4th one, they're suddenly better, that they've suddenly improved. So, 3-4 sessions, I think you start to get an understanding if a person is starting to recover. So, and then, obviously the steroidal injections are the next course of action, relatively inexpensive, relatively easy to do, and hopefully gives relief of pain. Now, the other thing I wanted to talk about is the older population, which is partly me. So great sympathy for anyone over, say, 50, 60 years old, because the tendons don't tend to be as strong. And if the steroid doesn't work, and you've got ultrasound scanning and MRI scanning that can have a look at what the tendon looks like. And this is very important because it gives you an idea of, are they amenable to treatment? On a scan, if anybody looks at the scan, it looks very much like you've got shadows and black and white. But essentially speaking, you've got 2 types of scan. One that shows water, one that shows fat. If there's water, it's usually inflammatory. If it's fat, it's due to degenerative change around the tendon. So when you look at muscles, tendons, and there's a lot of white, and this is a special scan called the T2 scan, where it highlights fat infiltration in a tendon, that means that the muscles atrophied and its fats come in, and the prognosis is poor. So you can always tell. And if that's the case, especially if a person of the older generation and nothing has helped, then you'll start to look at surgery as being the only course to help them. And certainly surgery is the only course if there's a complete tear in a tendon, because obviously if a tendon's gone, torn, the only way to fix it is to reattach it, to sew it together. And for this, well, I don't want to go into surgical techniques too much, but basically you put a surgeon puts a special anchor in the bone, and it's like a thread that goes onto the tendon, and it's very firm. You can check it. You can, well, I wouldn't have thought surgeons have tried it, but you can hang from them if you want to. They're very, very strong because they have to bring up your shoulder. You have to be able to lift things, and a shoulder can be repaired, especially with a complete tear, with these special anchors that are put in the shoulder. But again, only if there's sufficient tendon and the tendon is strong enough. And it goes back to my last talk about how important it is to keep up muscle strength, because that keeps up tendon strength and makes it much more likely, should you be unfortunate enough to suffer one of these injuries, that you will recover most likely with conservative treatment. But if not, if it ends up with surgery, you're much more likely to get a very good result. So I think that's the essentials of treatment. So it's conservative me, which I was obviously the best, but however, If that doesn't work, then there's either steroid injections, or for those complete tears, or there really is instability and the person isn't getting much better, and you've got other conditions taking place, then surgery might be important, subject to MRI scans to highlight exactly what the state of the tendon is, and of course to confirm the diagnosis. And that is, in a nutshell, hopefully I've kept within my time limit. I actually need to have a look of within a few minutes. Actually, I've gone a bit longer. So this was a bit longer because it's more important. So that is treatment of the shoulder. The next video, number 5, is going to be sort of a summary. So I'm trying to keep within 5 minutes for once. Okay, thanks very much for watching. I hope you like it, and let me know. Bye-bye.